All right, my name is Rachel Grant. I'm here with my wonderful volunteer, Alyssa. Here is my driver's license. I'm going to get into the camera so you can see it. And I have Alyssa here. I've got my 15x7 card, and I've got my equipment over here on this other side. So we're going to go ahead and get ready to begin. Hi, Alyssa. My name is Rachel. I'm the nurse practitioner. How are you today?
Good.
Good. Just a minute. I'm going to wash my hands, and then we're going to get started today, okay?
Okay.
All right. All right, Alyssa, before we get started, I want to kind of ask you a few questions. Can you tell me your age and your date of birth?
I'm 21 and my birthday is August 30th of 95.
Okay. And do you know who the president is right now?
Obama.
That's right.
Not Trump yet.
Not Trump yet.
God.
So how would you describe your mood today?
Good.
Good. So what I'm looking for right now is I'm just kind of assessing your mood. She is well dressed. She looks appropriate for the time of year. Her hair is all done up and beautiful because she's going to go out tonight on the town, and she's got to have beautiful hair for that. So she's alert and oriented ×3 and appropriate conversation. All right, the first thing I'm going to do, Alyssa, is we're going to do a full assessment from head to toe. I'm going to kind of go through things. I'll talk as we go through it, okay?
Okay.
All right, the first thing I'm going to do is I'm going to look at your skin. I notice that you have a tattoo on your right shoulder. And then do you have any abnormal moles or scars on your body anywhere? Okay. I see a few scattered moles on your back, but none of them look abnormal in size or color or borders, so that's good. You have a little cut right here. Where'd that cut come from?
Shoe. Somebody's shoe.
Somebody's shoe. Well,
Yeah.
that doesn't look like that. It's nice and it's not infected. It's just a little bit of fibrin. So nothing.
It's healing up.
It's healing
Yep.
up. All right. Now I'm going to go ahead and I'm going to pinch your skin right here.
Oh.
And this test to see how hydrated you are, and you've got good skin elasticity. So that's your skin turgor. Your skin is warm but not hot, so that's normal. I don't see any edema on your skin. It's nice and pale, which is consistent with your race. Next thing I'm going to be doing, I'm going to get back into the camera. Next thing I'm going to do is I'm going to be looking at your head and at your hair. So I'm going to just kind of put my hands through your hair and kind of look. You've got it parted it already. I'm looking to make sure you don't have any infestations or, lice or anything like that.
Just some weave, girl.
Yeah. Next thing I'm going to do is I'm going to go ahead and I'm going to feel your scalp. I'm feeling for any nodules. I'm wanting to make sure that your scalp moves.
Watch my tracks, girl.
I will. Make sure your scalp moves appropriately. Are you having any pain anywhere when I palpate your scalp?
Nope.
Okay, your hair is nice and thick. It's a bright. What color do you call that?
It's pink.
Is that fuchsia?
It's magenta, actually.
Magenta. It's beautiful.
Thanks.
Your hair is thick. I don't see any breakage. It's not dull. So it looks actually pretty healthy.
It's because it's weave.
Okay. All right. The next thing I'm going to do is I'm going to go ahead and I'm going to look at your eyes, okay? So, and I'm looking first at your head. I'm making sure your head is normal cephalic, which means that it's the right size. It's midline. It sits on your body appropriately. Your features on your face, your eyes, your nose, and your ears are symmetrical and in place where they're supposed to be. I'm looking at your eyebrows now and your eyelashes. You have hair evenly dispersed throughout on your eyes. I'm just going to touch your eyes real quick. I want to just kind of feel and make sure that you don't have any puffiness. This is called orbital edema. Your eyeballs feel nice and firm. So that's good.
Well, that's good relief.
I don't see any styes. Next thing I want you to do is, can I have you look up to the ceiling? I'm going to look at your conjunctiva, and they are nice and pink and moist. Your lacrimal canal is soft, and I don't see any discharge there. I'm going to go ahead and I'm going to look at the upper conjunctiva. Look down for me. That is also nice and pink and moist. Your sclera is white. Your pupils are about 2 millimeter black. Your irises are green. And then I'm going to kind of just look at the lens of your eyes here on the second. I don't see any cloudiness in your lens of your eyes. All right, so the next thing I'm going to do is I've got some eye tests I'm going to do for you. The first eye test that I'm going to do is called the Snellen test, and this will test your vision from far away. This also verifies that your optic nerve number 2 is your cranial nerve, which is a sensory nerve, is intact, all right?
Okay.
So what we're going to do next is we've got a Snellen chart on the other side, and I'm going to go ahead. I need you to come stand right here where this little piece of tape is. Okay. I've got the Snellen chart. This is going to see your far-sightedness. You also can use another chart called the Rosenbaum chart, and that is to see what your near vision is. So let me come over here. I need you to go ahead. First, we're going to try with both eyes. Are you wearing any contacts, Alyssa?
No.
Okay. Go ahead, and with both eyes, start up here and tell me what you see. Read the line, please. And the next line?
FP.
The next line?
TOZ.
The next line?
LPED.
The next line?
PECFD.
Next line?
EDFCZP.
And the next line?
FELOPZD.
And this line?
DEFPOTEC.
All right. Can you read below that?
LETODPOT.
Okay. Your vision is what we call 20/20 with both eyes. Now what I need you to do is cover your right eye, and we're going to do it again, okay? Can you tell me the top?
E.
Next line?
EP.
The next line?
TOZ.
The next line?
LPED.
Next line?
PECFD.
Next line?
EDFCZP.
The next line?
FELOPZD.
And this line?
DEFPOTEC.
Good. That means your left eye has 20/20 vision. Can you go ahead and cover your left eye for me? Let me give you a second to readjust. It's kind of hard. Okay, you ready?
Yeah.
Okay, go ahead and start at the top.
E. FPTOZ. LPED. PECFD. EDFCZP. FELOPZD. DEFPOTEC.
Good. That means you have 20/20 in your left eye. So your eyes have 20/20 bilaterally and individually as well. All right. Go ahead. I'm going to dim the lights down just a little bit for the next test. Go ahead and come sit back in the chair. Let me grab some handy instruments that I need. All right. You can see better if I'm on this side. All right. So, I'm going to go ahead and do this. Raise the camera just a little bit for us so maybe they can see us both better. All right, you see that's the Y in that sign right there?
Yeah.
Can you go ahead and I just want you to look straight at that, okay? First thing I'm going to do is I'm going to come up, I'm going to go ahead and I'm going to shine a light in your eye. I'm testing your corneal reflex, and you have reflection equal in both eyes, and that is good. That means your corneal reflex intact. The next thing I'm going to do is I'm going to go ahead and I want to test your eyes to see how your pupils react to light, okay? So I'm going to test your right eye first. Your pupil constricts with light. That's good. Go ahead and test, I'm sorry, that was your left eye. I'm going to test your right eye. Your pupil, again, reacts with light. So that's good. Next thing I want to do is I want to see if you can do what we call accommodation. I'm going to go ahead and I'm going to bring this pen. Just look out to the sign again. Go ahead and bring the pen in. Focus on the pen now. And go ahead and come back out. Good. So what I'm seeing there with accommodation is your pupils, as it gets closer, your pupils are getting smaller. And as it gets farther away, your pupils are getting bigger because it's trying to see a farther distance. So that's a good thing. The next thing I'm going to do is I'm going to test what's called the cover eye test. I'm going to have you take this card for me. And I'm just going to have you go ahead and look at the Y again. I'm going to cover this eye. And now I'm going to uncover that eye. All right. And that eye is not deviating. It's following the eye that when you were looking at. I'm going to go ahead and do it on your next eye. Stare at that wide. And once again, your eyes are not deviating. So that is good. That means you don't have a lazy eye. You're not what we call cross-eyed or have any of those things. Okay, next thing I want to do is I'm going to go ahead. I want you just to look at my pen. Okay, we're going to go through the 6 cardinal fields. I'm going to have you look up. What's lateral? Down, down. I'm going to go back in. I'm going to go back. Good. Your eye actually went through all of those movements smooth. Minimal, what we call nystagmus, which is a little bit of shifting when you go the far lateral. With your eye movement, there's 3 cranial nerves that work on your eye movement. There is your cranial nerve number 3, which is, I can't remember off the top of my head. I'll look at my card here in just a second. You've got cranial number 3, 4, and 6. 6 is called the abductus. It's a motor nerve, and that's when you go the most lateral on your eyes that we saw. Then also, you have 4, which is your trochlear. It's a motor nerve. And then you have number 3, which is your ocular motor nerve when your eyeball goes up and down. And so the fact that you did all of those good, that's wonderful. The next thing I'm going to do is I'm going to go ahead and I'm going to look into your eyes with a special little device. It might kind of sting your eyes for a second, but just bear with me and it will be okay. It's in my pocket.
Sting?
No, it's just a bright light. It doesn't sting at all. Okay, so the next thing we're going to do is I'm going to go ahead and I'm going to come in on your, I'm going to do what we call bracing so that I don't hit you with it. Okay, I'm finding the red reflex. I'm going in, I'm looking at the optic disc. The margins on the optic disc are normal and well defined. I'm not seeing any AV nickage, hemorrhages, or exudate. Good. I'm going to give you a minute to kind of rest that eye. I'm going to come over and I'm going to do the other eye. Okay. I have to kind of adjust my eyes since I've got monovision. There we go. All right, I'm going to go ahead. I'm going to come in, find the red reflex, follow the red reflex into your eyes. I'm looking at the optic disc and the nerve. And the optic disc is nice, round margin, well defined, oval, clear. I'm not seeing any AV nicking or exudate or hemorrhages on your blood vessels. All right. Thanks for that. I know that's a little uncomfortable to have to do. All right. So we have gone through all of your eye tests. Next thing I'm going to move down. I'm going to work on your nose next, okay? So what we're looking for on your nose is I'm going to kind of fill your nose to make sure there's not any lumps or bumps. Your nose is midline. You have a nice, beautiful nose that's midline. It's not deviated anywhere. Can you look up at me? The septum is midline as well. Go ahead and tell me if you're having any pressure when I do this or any pain. Okay, I don't feel any nodules. Next thing I'm going to do is I'm going to go ahead and I'm going to get my light here so I can look up inside your nose a little bit better. While we're doing this, I have a question. Do you are you able to smell things when they're stinky or when
Yes.
Okay. That's tracing your cranial nerve number 1, which is your olfactory nerve, and that's a sensory nerve. All right. Let me go ahead. I'm going to have you lift up. I'm going to go ahead and I'm going to look at your nasal mucosa. Okay, I don't see any postnasal drip and your nasal mucosa is nice, pink and moist. I don't see any polyps. I don't see any lesions up there. So that is it for your nose. Next thing I'm going to do is I'm going to go ahead and I'm moving over to your ears, okay? So tell me, we're going to do some fun ear tests here. Do you have any issues with your ears? I'm going to look, first of all, I want the pinna to be in line with your orbital socket, and it is. I'm going to go ahead and just feel your ear and tell me if you're having any pain. No pain on the mastoid process or with the auricle. No pain when I'm pressing here. There's no nodules. I see some ear piercing. And I feel a little bit of what I call keloid scar on your ear piercings, but other than that, your ears feel normal. All right. Next thing I'm gonna do is I'm gonna look inside your ear, okay? All right. I kind of have found a system that works the best for me on looking inside people's ears. Go ahead and sit back on that for me. I'm a little cold. I'm sorry. You want me to get you a little blanket while I'm doing this? And we can. Okay. All right. So I'm going to go ahead. I'm bracing my otoscope so you don't hear this. Your ear canal is nice. I don't see any swelling. You doing okay there? Mm-hmm. You do have slight scarring on the right side of your tympanic membrane, but other than that, your tympanic membrane is nice, pearly white, and I can see the tympanic bone. I don't see any bulging or redness. And I see the light reflex at 7 o'clock on the cone reflex. I'm going to go ahead and I'm going to come and look at your other ear. Once again, I'm going to pull up here. I'm using this to brace. You have a little bit of wax in there called cerium, which isn't bad. Switch my eyes. Okay, your tympanic membrane is nice and moist. There's a little bit, this one's a little bit white behind it. It's not completely pure gray. I see a little bit of a bulge. And I can't see the light reflex on that, I think because it's so white. Have you had a sinus infection or you've had any drainage? Some allergies going on? Okay. Just a little bit, I could see that it was just bulging a little bit, so you probably just have some allergies in there. All right, but no pain. Okay, and I didn't see any exudate coming through there. Next thing I'm going to do is what's called the Weber test, and then we're going to do the Rhines test. This test is fun, I promise. I'm going to go ahead and you're going to feel some vibrations. I want you to go ahead and tell me if you can feel it unilateral. Hold on a sec.
What does that mean?
Can you feel it in both ears?
Oh.
You know, let me do the next test. It's a little bit easier so you can get used to what the feel is, okay? The next test is called the Rhines test. I'm going to go ahead and I'm going to put this right outside your ear, and when you can hear it ringing, and then when you hear it stop, you let me know, okay?
I can hear it. Oh, stopped.
Okay, good. Now I'm going to put this little piece of metal right here back on your ear bone, and you're going to hear it, and then you tell me when you can't hear it anymore, okay?
Okay.
Good. So what you want is a 2 to 1. You can hear, which is what you had. You had about 22 seconds here and 11 seconds here. So that's normal. That means you've got good conductivity. And also your nerve right here that's on that bone works really well. So I'm going to go ahead and we're going to do this ear next.
No, I can't. No, I really can't.
Okay. All right. Let me go ahead and I'm going to do it on the bone. stops.
It stopped.
Okay, good. Once again, you were about right at 22 seconds. This one was about 10 seconds. So 22 to 10, that still is pretty good. That's great. All right, so I've done your ears, I've done your eyes, I've done your nose. The next thing I'm going to do is I'm going to move on to your lips. And on your lips, also before I do that though, I want to talk about the cranial nerve number 10, which is your vagus nerve. It's a sensory nerve. You can feel the vibration back there. I just want to make sure that's the right. Yes, I was right. So it's your vagus nerve, and that's where you can feel that vibration back there. Next thing I'm going to do is I'm going to go ahead and I'm going to look at your lips. I'm going to get a glove on because I'm going to look inside your mouth here. Your lips are nice and moist. I don't see any cold sores. I don't see any fissures. That's all really good. I'm going to go ahead and have you open your mouth for me. Can you say ah? Good. Your uvula goes midline. You do not have any tonsils.
Nope.
Okay, your tonsils are absent. I don't see any dental caries. I'm going to go ahead and pull your tongue out for me so I can get a really good look at your tongue. I don't see any lesions or sores on your tongue. I'm going to go ahead, I'm going to put my finger in your mouth and just feeling for any sores, anything that's irregular here. No broken teeth. That's all really good. Hey, tell me do you taste things pretty well?
Mm-hmm.
Okay. And then also while you're here, can you go ahead and stick your tongue out for me and move it side to side? Good. And can you puff out your cheeks like this? Good. All right. Those are some cranial nerves that we're working on as well, and we'll kind of go through those a little bit more at the end. And I'm not seeing any lip lag. That looks all nice and symmetrical and full. So we are going to move on to your sinuses. Now, what I'm going to do is I'm going to be palpating right here. I'm going to be pressing down, and these are what's called your maxillary sinuses. Tell me if you have any pain. And then I'm going to palpate your maxillary sinuses up here. No pain? Okay. And then what I'm going to do is we're going to go ahead and I'm going to have you open up. I'm going to look in there, and I can transilluminate your sinuses. This one actually, okay, I can transilluminate that one too. It's a little bit duller compared to this one, but they're both transilluminable. I'm going to go ahead and do the same thing. You've got some sinuses up here I want to look at. Okay. And those are both, I'm able to transilluminate them. Okay, next thing I'm going to do is I'm going to feel for your lymph nodes, okay? So I'm going to be feeling on your body here for a minute. First, I'm going to start with your occipital lymph nodes. Then your post-auricular lymph nodes, your pre-auricular lymph nodes, your tonsillar lymph nodes, what we call your submandibular lymph nodes, submental lymph nodes. Okay, now I'm going to do what's called your posterior cervical chain lymph nodes. I'm going to go ahead and I'm going to feel your anterior cervical lymph nodes. And then I'm going to go ahead and I want you to shrug your shoulders just a little bit. These are called your, I know you don't like that. These are called your supraclavicular lymph nodes. I know you don't like it, but those are the spots. If those are swollen, they tell us that we have some issues and we can have some lymphoma or cancer. So you always have to really check well in there. Next thing I'm going to do, I'm going to have you just kind of sit to the side here. And I am feeling for axillary lymph nodes. I'm sorry. I'm sorry. Okay. And then you've got some lymph nodes right here. I'm not quite sure how much. These are going to make you laugh. These are your epitrochlear lymph nodes.
It's my favorite ones.
Those are your favorite ones. Good. Glad I can make your day. All right. So we went through all of your lymph nodes there. Tell me, will you have any pain or tenderness when I press those? Okay. And none of your lymph nodes were palpable, so that's completely a normal exam on your lymph nodes. The next thing I'm going to do is I am going to look at your throat. I'm not seeing any redness or erythema is what we call it. First thing I'm going to do is you've got what's called your trachea here. I'm just going to come feel here, and I want to make sure, just go ahead and relax. I'm not going to hurt you. So your trachea is midline. Then this next test I'm going to do from behind because it's just easier for me to do it this way. I'm going to go ahead, I'm going to have you swallow, and when you swallow, I'm feeling for your thyroid and your trachea cartilage to move, and it does. That's appropriate. I'm going to go ahead and I'm going to have you swallow some water now. And I'm going to have you swallow it, and then when I say, go ahead and hold in your mouth. When I say swallow, go ahead and swallow. I'm feeling for any nodules. Okay, so go ahead and swallow. Your thyroid gland is smooth. I'm not feeling any nodules. So that is good. The next thing I'm going to do is I'm actually going to listen to that thyroid gland. Sometimes if you have a hyperthyroid, you have bruits, is what we call, because you got extra blood flowing to them. So I'm going to go ahead and I'm going to listen with my bell stethoscope just to make sure I don't hear any of those. You can hear some bronchial breath sounds, but no bruits, so that's good. While I'm here, I'm going to go ahead and I'm going to listen to your carotid arteries right here. And I'm listening for bruits on those as well. Okay, I don't hear any bruits there. I'm going to go ahead and I want to just fill your carotid arteries. Okay, your rate is normal on those, about 72 per minute. The rhythm is normal, and you have 2+ bilateral on that. Well, I'm going to go ahead. I'm going to check all your pulses since I'm already checking pulses. So next thing I'm going to do is what's called your brachial radial pulse. Those are regular, 2+. I'm sorry, these were your brachial pulses. Now I'm going to come back and these are your brachial radial pulses. Those are 2+ and normal. The next thing I'm going to do is I'm going to go ahead and let's put your feet up in the camera just a little bit. Well, just so I can feel your posterior tibial. Okay. They understand that you've got dirty feet. It's believing there's lots of patients with dirty feet. I can feel your posterior tibial. This is normal. I'm going to go ahead and feel this one. That's 2+ and normal, and this is your dorsal pedals, and that's a great one too. So that's a 2+. Go ahead and relax. And a 2+ on that one. Good, we got that part done. Awesome. All your bilaterally, all of your pulses were normal. There's no bounding, and that is good. All right, the next thing I'm going to do, Alyssa, is we are going to go ahead and we're going to move down on your chest. First thing I'm going to do once you get done stretching is I'm going to kind of look at you take a deep breath in and out. What I'm looking for is that the chest rises symmetrically. I don't have one side greater than the other, and it's not, I'm not seeing anything abnormal with your chest rise. If I were to come back, can you go ahead and turn this way, put your back towards me on the chair? And I can go ahead and I can put my 2 thumbs here in the intercostal space back here. Can you go ahead and breathe for me? And as she takes a deep breath, those are coming out equal and spreading out the same. Since I'm already on the back side, I'm going to do what's called tactile fremitus. I'm going to go ahead, I'm going to put my hands here, and while I go down your back, I want you just to say 99.
99, 99, 99, 99.
Okay, I'm going to go ahead and fill here. Do it again, please.
99, 99.
Okay, and then I'm going to come around to the front.
99, 99.
And come up underneath you.
99.
Okay, so tactile fremitus was present in all of the spots on your lungs, all of your lung fields. Next thing I'm going to do is I'm going to listen for lung sounds. I'm going to go ahead and I'm going to have you turn back towards the camera. on this, I'm expecting to hear what we call bronchial vascular. We've got 10 lung sounds in the front. I'm sorry, 8 in the front, 4 bilaterally, and 10 in the back for a total of 26. I'm expecting to hear bronchial breath sounds over the main bronchus, bronchial breath sounds over the trachea area, bronchial vascular over this area right here. There's your main bronchus. And then the rest of your lung field should be what we call vascular breath sounds, except for your right posterior upper lung. And there I hear some bronchial vascular sounds as well. So I'm going to go ahead and I'm going to start listening, okay? Take a big deep breath for me. Good job. I'm going to go ahead and have you lift your arms up above your head, and we're going to do the same thing over here for me. Great. Can I go ahead and have you step down from the chair and turn your back to the camera? You don't have to stand back up. If you just can turn your back to the camera so they can see that I'm doing all of the breath sounds back here as well. Okay, great. Go ahead and sit back on the chair. The good thing about that is I did not hear any what we call adventitious breath sounds or any crackles or anything. I didn't want to be hearing any rubs. Next thing I'm going to do is called percuss. I should be hearing nice tympanic sounds. That one, because you've got so much breast tissue, I might not hear as much of that. Go ahead. Put your arms up over here. I'm going to do this. Do both. Thank you. Sorry.
Tickles.
Oh no. And I'm going to come and do it back on the back. I'm percussing. If there's fluid in your lungs, it's a duller sound. So all these sounds resonate, and that's good. It doesn't mean I don't have any dullness or anything going on in your lungs. All right. Also, we want to talk to you about the shape of your lungs. Your anterior posterior lung line to transverse is a 2-to-1, which is normal. You're not what we call barrel chested. So that is good. Are you still cold, or do you want a blanket? Okay. Next thing I'm going to do is I'm going to move on to your heart. First thing I'm going to do is I'm going to look at your heart. I'm looking at your chest. I'm looking to make sure that we don't have any heaves or thrust or anything like this. And in regular exam, you would look into all of your heart sounds in 3 different positions. You would see you sitting like this. You'd have you supine laying down, and then also with you standing. But we're going to go ahead and just have you stay in this position for our purposes today. And next thing I'm going to do is I'm going to feel for your apical pulse. Point of maximum in where you should be able to feel it the most is at the 5th intercostal space, and I just can't.
600 cc's in there, girl.
Yeah, I just can't feel yours. But I tried. All right, but I have been able to listen to your heart before, so I'm going to go ahead and do that. There are several heart sounds we're going to listen to. The first is going to be listened to on your second right intercostal space on the right side of your sternal border. That is going to be what is called your aortic valve that I'm going to be listening to. Then on your second intercostal space on the left sternal border is your pulmonic valve. Then on your third intercostal left sternal border, I'm going to hear Erb's point. That's where you can usually hear S2 the loudest over S1. Then I'm going to hear your third intercostal left sternal border. I'm going to hear your tricuspid valve. Then we're going to come to your fifth intercostal space, mid-clavicular, and that's where I'm going to hear your mitral valve. So I'm hearing to see if I hear any murmurs, any gallops, anything irregular going on there. So let me go ahead and do that. First of all, I'm going to start out with my diaphragm side, and then I'll move on to my valve side. And while I'm here, I'm also going to get your rate. All right, your heart rate is 72, which was matched up to your carotid artery. So that was a match. That's good. I went ahead and did your respiratory rate while I was counting there, and your respiratory rate is 12. So here we go to my next valve. This is the pulmonic valve that I'm listening to. This is Erb's point that I'm listening to. Now we're going to listen, got to come in here, hear your tricuspid valve. And then I'm going to come up underneath your bra so that I can hear your mitral valve. Okay, and all of those sound good. I didn't hear any murmurs, gallops, rubs on your heart sounds. So that is good. We're done with the heart portion. We've done the lung portion. I'm going to look at my notes real quick and make sure that I've done everything I need to do here, and then we're going to do your abdominal section up on the table. I wanted to make sure I got the cranial nerve 8. I need to do one test that I didn't finish up on you. I want to go ahead and we're going to redo what we call the Weber test, and you tell me if you can feel the vibration equilaterally. Let's try it one more time.
Oh, I thought I was just doing when it stops.
Oh no, I just wanted, could you feel the vibration in both ears that time? Okay, that's what I was going for there. And then we had your cranial nerve number 8 is whether you can hear me or not. I'm going to go ahead and I'm doing what's called the whisper test. You tell me what you can hear, okay? Okay, good. I'm going to come over to the other side.
Hamburger.
Good. All right, so we are done with that. Let's go ahead and let's put you on the table. The vent isn't blowing right on you on the table too, so that should make you feel a little bit better. Why don't you come sit with us this way?
These hills.
Huh?
Big ones.
Okay, go ahead and lay down for me. I'm gonna try and do as much as I can. Is that comfortable for you at the moment? Okay. The next thing I'm gonna do is your abdominal exam. And for this exam, we go ahead and we cut your abdomen into 4 sections. Try and get the camera where it can see us a little bit better.
stay. There we go. Perfect.
You're so smart, Alyssa. Thank you. Okay. So, yes. All right. So what I'm going to do is I'm going to stand on this side. I think you'll be able to hear. I'm going to go ahead and I'm going to take your stomach. I'm going to look at it first for shape and symmetry. I don't see any unusual venous pattern in it. Your skin is nice and moist. I don't see any edema. I'm not seeing any hernias or bulging on it, so that is good. Your stomach is flat and appropriate. So I'm going to go ahead and I'm going to divide your abdomen into 4 different spots, okay? And I'm going to listen to all 4 different areas. On this one, I listen before I do anything else. This area here is where your liver is. Bowel signs are normal active. Bowel signs are normal active. Normal active. And normal active. And you know what? I just remembered is I did not listen to your heart with the bell of my stethoscope, so I'm going to go ahead and do that real quick while you're on the table. I'm going to listen to all those different points with the bell of my stethoscope. Okay. Also, while I'm on your stomach, I'm going to go ahead and I've got the bell of my stethoscope still out, so I'm going to listen to what we call your epigastric area. And that is normal also. Okay. Next thing I'm going to do, Alyssa, I'm going to just kind of touch your belly softly. This is just so I can find any tender areas if you have any. And then I'm going to do what we call deep palpation. I'm going to go ahead and I'm going to go in deep in all 4 quadrants. I'm unable to palpate the spleen, and that's good. You don't want to be able to palpate that. All right. Next thing I'm going to do is I want to go ahead and I'm going to do a test to test whether you're, it's called the Murphy sign. What I'm going to have you do is I'm going to press in on your stomach at the same time. This is testing your gallbladder, and you tell me if your gallbladder hurts, you won't be able to test. Breathe in. Okay, so go ahead, take a big deep breath in. Okay, good. So that is a negative Murphy's test that I tested for. Next thing I'm going to do is I'm going to what we call percuss your abdomen. And that's good. Those are all tympanic sounds, which is what we want. All right, next thing I'm going to do is I'm going to move this up a little bit. I'm going to go ahead and assess for your liver. Okay, so we're right there on your liver. I'm going to go ahead and just mark that spot. He was supposed to not have the dog barking. All right, I'm going to go ahead and I need to come down here. It's going to be kind of hard. I think if I go this way, I'm going to be able to. Okay, I think this is where this lands. It can go. Okay, so your liver mass goes from there to there. Let me get my measuring tape. Your liver span is 8 centimeters, which is within normal range. All right, so I did all your abdomen. Next I'm going to go ahead and we are going to kill the child. All right, so while I've got you here, I'm going to go ahead and I'm going to do your range of motions so we can do your hip range of motions because we have to do this on the table anyways. So what I'm going to do, the first thing I want you to do is I want you to take at your hip, I want you to keep your leg straight, and I want you to just bring it up into the air. Good, and that should be about 180 degrees. What's what that is, that's active range of motion. With passive range of motion, I can bring it another 5 degrees. I want you to go ahead and do it on this one for me. She's not having any pain. With passive range of motion, I'm able to go back up a little bit more, okay? That's flexion with straight knee. Then what I want you to go ahead and do is I want you to go ahead and do what we call abduction. I want you to bring out your hip as far as you can. Go ahead and keep this straight like this. Good. Should be about 45 to 50 degrees. Let me go ahead and if I do passive range of motion, I can go about 5 degrees more. You can go ahead and do it on this one. Okay, go ahead. Let's get your leg. This one's a little bit harder just because of our tail. Okay. And with passive range of motion, we can go about 5 degrees more. Also, I'm going to test the strength. So go ahead and I'm going to have you pull it out here and then try and pull back. Try and pull back. Good. I'll do the same thing with this one. Pull back. Good. Your muscle strength is equal bilateral. Now what I want you to do is I want you to do a scissor. I want you to take this and scissor this hip over this hip. There you go. Good. There's passive range of motion. Okay. Go ahead and scissor that way. Good. And then when we have you here, I'm going to go ahead and I'm going to look at your knee. So that your knee can go, if we bend your knee, that's good. And then try and go your knee straight out as you can. All right. Put your knee back. Let's do this one. And your knee up. All right. Good. So you went through all the range of motions without any pain, and you have full range of motion. Now the one thing I need to do is we're going to look at your hyperextension on your hip. So I need you to go over on your stomach for me.
Oh, jeez.
Okay. Let's take the pillow off so you can. Okay, go ahead and put your leg down. And go ahead, keeping your leg straight. Pull your hip up from your hip. Just lift your leg up. Good. Okay. Go ahead and press against me. Good. Okay. Let's go ahead on this one. I need to go ahead and straighten you up. Press against me. All right. You've got good joints there. All right. Alyssa, I'm going to go ahead and I'm going to have you sit on the table. I'm going to go ahead and do some deep tendon reflexes while I have you in this position. Maybe a little tricky, but we're going to give it a try here. Okay, I'm going to start here. This is your brachioradial reflex, deep tendon reflex. And you saw how that's present. Then I'm going to go ahead and just relax. There you go. It's not there. Now I'm going to do this one here. Should tricep reflex. There you go. All right. Let me go ahead and have you lay in one here. Can you see that muscle go? You felt that one? Yeah. Okay. Go ahead and just relax.
There you go. That's your tricep reflex. And go ahead and I'm going to put the camera down a little bit. We're going to go ahead and do your patellar reflex, and then I'm going to get your ankle reflex while we're here as well. Okay, just relax. You can kind of just. There we go. There we go. Good job. Now I'm going to go ahead and I'm going to point the camera down even a little bit further. I know you don't want anyone to see your feet, but you'll be okay. All right, so here is where we're going to get your deep tendon reflex on your ankle. I'm going to go ahead and get this one. Okay, also I'm going to do your Babinski reflex. I'm going to go ahead. I like to do this one with my pencil. Okay, go ahead and just kind of relax. You see how that's okay. What we want is your big toe to come up and your feet to fan. I'm doing it on the outer side. There you go. You see how your toes kind of span and your toe up? That is your Babinski reflex. All right, next thing I want to do is I'm going to have you come sit back down on the chair here. I'm going to move the camera back to where we were before. Okay, so check your hips and your knees, and I'm going to go ahead. I'm going to have you put that around you like this because I need to get your elbows. And then we're going to look at I'm going to start up here on your range of motions. All right, first thing I need to do, Alyssa, is I need you to go ahead and take your jaw open and close your jaw for me. Okay, that's good. She about 3 to 6 centimeters open when she opens her jaw. Should be no popping or clicking. Then I need you to clench your jaw down really tight. Okay, what that is right there is your cranial nerve number 5, and that's making sure that is functioning. Go ahead and do your jaw side to side for me. Good, and then out front. Jut your mouth up front. Good job, thank you. Now we're going to go ahead and I'm going to look at your cervical spine. What I want you to do here is I want you to go ahead and I want you to push your forehead down to your chest. That's active. With passive, I can go forward. I want you to go ahead and look just up. Oops, look, this is flexion. Should be about 45 degrees, and I want you to go all the way back, as far back as you can. And that should be about 45. That's good. Go ahead and come back on up. All right, now what I want you to do is I want you to go side to side. So I want you to take your ear and touch your right shoulder. I want you to take your left ear and touch your left shoulder. Good. I'm going to go ahead and do it again so I can test your strength. Okay, do the other side. Okay, we're going to do it one more time, and I'm going to press for passive range of motion. Okay, we're going to come back and do passive range of motion. All right, now I need to go ahead and have you take your chin and push it down to here. And then take your chin and push it down into here. Good job. We also are testing some other nerves that I can't remember, so we'll go back to those here in a second when I can think about all my nerves at the same time. The next thing I'm going to do is I'm going to test your shoulders. So first thing I need to do is I want you to take your arms out to the side and bring them all the way over your head. You should be able to do that at 180 degrees. Okay, go ahead and bring them back down. Then I also want you to go ahead and stand for this one. I want you to take your elbow, your shoulder, and I want you to go bring it just in front of your body. And show the camera. Okay, that should be about 50 degrees on that shoulder. That's good. Go ahead and come back the other way. Should also be about 50 degrees. Now I want you to go ahead and take your shoulders and bend them all the way back towards your back. Good. Go ahead and do passive with that. Good. Okay, the next thing I want you to do
is
Sweet pen.
the pen mark that I put on you. We did all our shoulders. Well, we're here. I want you to go ahead and I want you to stand here. I want you to go ahead and bend your knee. You should be able to bend your knee about, no.
Oh.
That's okay. I want you to go ahead and stand on your right leg and bend this knee as far back as you can. And you should be able to go about 130 degrees, which you can. And there's passive. I want you to go ahead and I want you to extend that leg as far as you can from your knee.
Forward?
Yep. That's wonderful. You should only be able to hyperextend the knee 15 degrees. Go ahead and we're going to do the same thing on this leg. I want you to go ahead and bend the knee right at the joint. Stand straight. Okay. And go ahead and hyperextend the knee with keeping your hip joint straight. Okay, good job. Those are wonderful. All right. I'm going to go ahead and I want to test your fingers now. I want you to go ahead and we're going to do,
Oh, jeez.
okay, we're going to put your fingers up here. That's okay. I want you to hold your fingers out straight like this. I want you to take your fingers and just curl 90 degrees straight down. Okay, good. And then I want you to take and make a fist. Then I want you to take your finger and touch your thumb with all of your fingers. And come back. And then take your big thumb and touch the pad of your pinky finger. Good. Okay, on your wrist, I want you to go ahead and bend your wrist down. This should go down 90 degrees. And then should come back up 90 degrees as well. Good. Then I want you to take your hands. I want you to go ahead and spread all your fingers out. Put your fingers together. Okay. Another thing that I want to do is I want to go ahead and inspect your nails. We do have one nail that is available for us to look. So Alyssa has some artificial nails, but her cuticles are nice. I don't see any pitting in her nails or ridges. I don't see any lesions on her nails. I'm going to do a capillary reflex on your nails. And that is less than 3 seconds. So that is what we're looking for. All right. On your elbow, I want you to kind of do a bicep curl. Go ahead. Join on your elbow. Okay. And then I want you to go ahead and put your elbow straight and go out as far as you can. Good. Come back. Now what I want you to do, we're going to go ahead and should go 180 degrees. So this is supination position. I want you to go ahead here. Okay, put your back to the camera. I want you to go ahead and I want you to flip them over. Okay, perfect. You're able to do that joint without any problems. Okay, now you can sit back down. One thing I wanted to talk to you about is your spinal accessory nerve, which is nerve number 11. You're going to go ahead and I'm going to see that that motor nerve is intact when you can show your shoulders. Okay, that is good. I need to test you for scoliosis, so can you please come back down? Okay, and go ahead and turn towards me. I want you to bend over and touch the floor. And what I'm looking for is to make sure that your spine is nice and midline and we're not seeing any lateral bending or S-curve. I do not. Go ahead and stand back on up. Okay, now I'm going to test for your balance. I'm going to do what's called the Romberg test. I need you to stand. Go like you're praying in a position and close your eyes. And I'm looking to make sure that your equilibrium's there. You're not having any. Okay. That's good. Being your Romberg test, you're not having any issues with that. All right. So we have gone through all of our cranial nerves. We went through cranial nerve number 1, which was a sensory nerve. I'm going to put my eyes back in. Cranial number 1, which was a sensory nerve, and that was the olfactory nerve. Then cranial nerve number 2 was the optic disc nerve. And we were able to see that when she did visual acuity for us.
nerve number 3 is the ocular motor nerve, and that is when tested when the eye is able to move up. Number 4 is the trochlear motor nerve, and that is when the eyelids, the eyeballs are able to come focus in and down. Number 6 is a cranial nerve. It's a motor nerve, and it takes the eyes back and forth laterally. Number 5 is the trigeminal nerve, and it was tested for motor wise when she clenched her jaw. It also has some sensory. I'm going to go ahead, and what I want to do, Alyssa, now is we need to test. I want to be able to you to tell me if you're going to close your eyes, and you're going to tell me if what I'm doing feels soft or whether it feels hard. So we're going to go ahead, and I'm going to do that right now. So if you can sit down real quick. Go ahead and close your eyes. Okay. Got your eyes closed? Tell me if this feels sharp.
No. That did.
So this is testing the sensory nerves on cranial number 5. Is that sharp?
Yeah.
Okay. And then I had, go ahead, close your eyes again. Can you feel that?
Mm-hmm.
How does it feel?
Soft.
Good. And you do this on your arms. Go ahead and open your arms up. Keep your eyes closed. Tell me if this is sharp.
Yes.
Okay, tell me what this feeling is.
Smooth.
Soft? Okay. We're going to go ahead and I'm going to do your lower extremities.
Oh, sure. It's like, oh.
Okay. And go ahead and do the other side.
Soft. Sharp.
Go down here.
Soft.
Let's try again.
I can't.
Okay.
Okay, soft.
All right. Sounds good. Also, I want to test and see on your foot if you can feel this vibration, okay?
Yes.
Okay. All right. So the cranial nerve number 5, we said is a motory and a sensory nerve, and it's the trigeminal nerve. Number 6, we've already talked about. It had to do with the lateral eye movement. Cranial nerve number 7 is shown with facial features. That's the motor part of it. And also it has a sensory part to it where she can taste. That's number 7. And it's called the facial nerve. Number 8 is the auditory nerve. And we saw that in the whisper test. She was able to hear. It's a sensory nerve. Number 9 is the glossopharyngeal nerve, and that is when we explicit a gag reflex. She's able to swallow. Those are motor neurons. Number 10 is the vagus nerve. It has a parasympathetic response. It has issues into your cardiac reflex. Excuse me. Number 10 also. I can't remember the name for number 10. I'm pretty sure number 10 is the vagus nerve. So I'm going with that. 10 is the vagus nerve because it has the carotid infiltration. Number 11 is the spinal accessory nerves. It's a motor nerve, and she was able to show us when she shrugged her shoulders. Okay, let me look over this. I think we're going to be done, Alyssa. All right, that is all we have for today. Thank you.
Great.